ageism get in the way of communication? So, ageism, prejudging somebody because of their age. It can show up in a lot of ways, and some of them are pretty sneaky. Have you ever thought about how ageist preconceptions can get in the way of communication? Well, they can. And I think we've all been guilty of them. I know I have. Let me give you some examples. A lot of people, when they're talking to older adults, will adopt certain speech patterns. They might not even realize they're doing it. But a person will often use more simplistic language. They might increase the volume and pitch of their voice. They might even use sort of baby talk. You know what I'm talking about, right? And if you're being spoken to in that way, it's probably going to make you less likely to want to keep talking. It might make you feel like you're being condescended to. And that's coming from a place of ageism. The person is assuming that the older adult is less likely to be able to understand if they just speak in a normal tone and use a normal vocabulary. It is good to speak a little bit more slowly and clearly. It's important to allow space to make sure that the person you're talking to has registered what you're saying. But those other modifications of the pitch and volume and vocabulary are probably not advisable. Other ways that ageism can get in the way of communication is that people sometimes will feign deference. So they'll be a little bit overly respectful in, again, kind of a condescending way. Sometimes people will avoid talking to older adults, thinking that they're going to be overly talkative or talk about things that aren't really relevant. Sometimes people will even defer to the person who's accompanying the older adult rather than talking to the older adult themselves. This can happen especially if there's a suspected or known cognitive impairment, like dementia. It's important to communicate with the older adult themselves, no matter what the situation. Learning about ageist preconceptions is the first step in abolishing them. If you're an older adult yourself, then feel free to point these out if somebody is using some of these modifications and you don't appreciate it. You could also do that if you're a care partner. You can do that in a gentle and respectful, kind of educational way. And if you're a health professional who works with older adults, you'll probably catch yourself sometimes accidentally sliding into these modifications. I know sometimes I do, and just correct it. It's okay to apologize for using language that wasn't the best choice and then avoiding it in the future. For more information about aging, go to www.thewrinkle.ca.